Most seniors assume leg pain after 60 is simply a normal part of aging, something to manage and accept. But there are 5 specific signs that distinguish ordinary aging discomfort from something else entirely. Sciatica, a nerve issue that responds very differently to treatment than general muscle aches do. Tonight I am walking you through all 5 signs, one at a time, exactly what each one feels like and why it points specifically toward the nerve rather than ordinary wear and tear. And at the end, one simple food most people throw directly in the trash that research has shown may help calm that nerve pain. Stay with me through all 5 because the order in which these signs typically appear matters just as much as the signs themselves. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below right now, your age and your city. I read every single comment personally. Now let us get completely into this. 2. Why this distinction actually matters. Before we get into the 5 signs themselves, it is worth understanding why distinguishing sciatica from ordinary aging discomfort matters in the first place, beyond simply having a more precise label for what you are feeling. Ordinary age-related leg discomfort, the kind that comes from general muscle stiffness, mild arthritis in the knee or hip joints, or simple deconditioning from less activity, typically responds well to general approaches, gentle movement, basic stretching, and over-the-counter anti-inflammatory support used as needed. Sciatica, by contrast, originates from irritation or compression of the sciatic nerve itself, usually at the point where it exits the lower spine, and it often requires a more specific approach, one that addresses the nerve root and the structures compressing it, rather than simply the muscles in the leg where the pain happens to be felt. Treating sciatica as if it were ordinary muscle soreness, applying heat, taking a general pain reliever, and simply waiting for it to pass frequently provides only partial or temporary relief because the actual source of irritation, often higher up near the lower spine or deep in the hip, is never addressed. Recognizing which type of leg pain you are actually dealing with changes what kind of approach is likely to help. Sign 1. Pain that travels rather than stays in one place. The first and often most telling sign is the path the pain takes through your body. Ordinary muscle aches and general joint discomfort from aging typically stay relatively localized, concentrated in one specific area, such as the knee, the calf, or the lower back alone. Sciatica behaves differently, because the sciatic nerve itself runs from the lower spine, through the deep hip, down the back of the thigh, and often all the way to the calf and foot. Irritation anywhere along that nerve's path can produce pain that travels along the same route. Many people describe it as a line of discomfort running from the lower back or buttock, down the back or side of the thigh, sometimes continuing past the knee into the calf or even the foot. If you notice your discomfort following this kind of pathway, rather than staying confined to a single joint or muscle group, this is one of the clearest indicators that a nerve, rather than a joint or general muscle group, is involved. The traveling nature of the pain reflects the actual physical structure of the nerve being irritated along its length, not simply discomfort radiating outward from a stiff joint. Sign 2, a burning or electric quality, rather than a dull ache. The second sign relates to the actual character or quality of the discomfort, not just where it is located. Ordinary muscle soreness and general arthritis discomfort typically feel dull, aching, or stiff, the kind of sensation you might describe as deep, heavy soreness after overusing a muscle or joint. Sciatica frequently produces a noticeably different sensation, often described as burning, electric, sharp, or shooting. Many people specifically use words like a hot poker sensation, an electric shock running down the leg, or a sharp jolt with certain movements. This distinct quality exists because nerve tissue, when irritated, produces a different type of pain signal than muscle or joint tissue does, often perceived as more intense, more sudden, and qualitatively different from ordinary soreness. If your leg discomfort includes this burning, electric, or shooting quality, particularly if it appears suddenly with certain movements like bending, twisting, or sitting in a specific position, this points toward nerve involvement specifically, rather than general muscular or joint-based discomfort. Sign 3, numbness or tingling alongside the pain. The third sign is the presence of numbness or a tingling pins and needles sensation somewhere along the leg, often in the foot or toes, alongside the pain itself. Ordinary muscle aches and joint stiffness from aging do not typically produce numbness or tingling. These sensations specifically occur when a nerve signal transmission is being disrupted, either through direct compression or through the inflammation surrounding an irritated nerve root. The brain receives a confused or reduced signal from the affected area, which is experienced as numbness, tingling, or a sensation often described as the leg or foot falling asleep even when you have not been sitting in an unusual position. If you notice numbness or tingling, particularly in your foot, your toes, or a specific strip running down your leg, especially if this occurs alongside the pain rather than as a separate, unrelated symptom, this strongly suggests the sciatic nerve itself is involved, not simply a sore muscle or stiff joint. Sign 4. Specific movements or positions consistently make it worse. The fourth sign involves noticing a consistent pattern between certain movements or positions and a worsening of your symptoms. Ordinary age-related discomfort tends to feel relatively similar throughout the day, perhaps slightly worse after a long period of activity in general, but without a sharply specific trigger. Sciatica frequently has a much more specific relationship with particular positions or movements. Many people notice their discomfort intensifies specifically when sitting for extended periods, when standing up from a seated position, when bending forward, or when coughing or sneezing. This happens because these particular movements and positions change the mechanical pressure on the lower spine and the nerve roots exiting from it, either increasing or decreasing the compression on the irritated nerve in a fairly predictable way. If you find that sitting for a while consistently makes things worse, or that standing up from a chair produces a noticeable spike in discomfort, or that bending forward in a specific way reliably triggers the pain, this consistent relationship between a specific movement and your symptoms is a meaningful sign pointing toward nerve root involvement rather than general, less predictable age-related discomfort. Sign 5. One-sided symptoms that do not match on both legs. The fifth and final sign is asymmetry, meaning the discomfort, numbness, or weakness is present predominantly or entirely on one side rather than affecting both legs in a similar way. General age-related changes such as widespread arthritis or simple deconditioning often, though not always, tend to affect both legs to a somewhat similar degree, since the underlying cause, such as joint wear or reduced activity, typically applies to both sides of the body fairly evenly. Sciatica, because it usually originates from a specific point of nerve root irritation on one side of the lower spine, most commonly produces symptoms that are noticeably worse on one particular side or present on one side only. If your right leg has been bothering you significantly while your left leg feels essentially normal, or vice versa, this one-sided pattern is a meaningful sign pointing toward a specific nerve root issue rather than a generalized bilateral aging process. What to do if several of these signs apply to you? If you recognize 2 or more of these 5 signs in your own experience, particularly the traveling pain pattern combined with the burning or electric quality, this is meaningful information worth bringing directly to your doctor, described in these specific terms rather than simply saying your leg hurts. Describing the traveling pattern, the burning quality, any numbness or tingling, the specific movements that worsen it, and whether it affects one side or both, gives your doctor much more useful information to work with than a general description of leg pain and can meaningfully speed up an accurate diagnosis. If you experience sudden, severe weakness in the leg, difficulty controlling your bladder or bowel function, or pain that comes on suddenly and severely after a fall or injury, these are signs that require prompt medical attention rather than simply tracking symptoms at home, since they can indicate a more urgent nerve compression issue. One simple addition worth knowing about before we finish tonight: here is something most people throw directly into the compost bin or the trash without a second thought: watermelon rind. The white part just beneath the outer green skin that most people cut away and discard before eating the red flesh. That white rind contains a meaningful concentration of an amino acid called citrulline, notably higher than the concentration found in the red flesh of the watermelon itself. Citrulline is converted in the body into another compound called arginine, which plays a direct role in supporting nitric oxide production. Nitric oxide helps relax and widen blood vessels, supporting improved blood flow throughout the body, including to tissues surrounding an irritated nerve. Improved local blood flow matters here because irritated, inflamed nerve tissue depends on adequate circulation to clear inflammatory byproducts and deliver the oxygen and nutrients needed for the surrounding tissue to settle and recover. While this is a supporting mechanism rather than a direct treatment for the structural cause of sciatica, such as a compressed disc or a tight piriformis muscle, it is a simple, food-based addition that costs you nothing extra, since you likely already have watermelon rind available whenever you cut into a watermelon sitting in your trash rather than on your plate. To use it, simply cut the white rind into smaller pieces and blend it into a smoothie along with the red flesh, or juice it directly if you have a juicer, since the rind itself can be somewhat tough and fibrous to eat on its own. Many people find blending it with a small amount of the red flesh, a squeeze of lime, and a few ice cubes makes it genuinely pleasant to drink rather than something you are forcing down purely for the potential benefit. This is general educational information, not a treatment for sciatica itself, and it should not replace any approach your doctor has recommended for managing nerve compression specifically. If you have kidney issues or are on medication affecting blood pressure, mention this addition to your doctor before making it a regular habit, since compounds that influence blood vessel relaxation can interact with certain conditions and medications. Drop a comment and let me know how many of these 5 signs matched what you have been experiencing. Subscribe for more specific, practical information like this every week. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. If you experience sudden severe weakness, loss of bladder or bowel control, or severe pain following an injury or fall, seek emergency medical attention immediately. Those with kidney conditions or on blood pressure medication should consult their doctor before regularly consuming watermelon rind due to its effect on blood vessel function. Individual results vary. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Viewer discretion advised.